Imagine waking up with a strange, crawling sensation in your mouth. You check in the mirror and spot tiny, wriggling white larvae in your gums. It sounds like a horror story, but this is a real medical condition, oral myiasis. Oral myiasis is an infestation of the mouth by fly larvae or maggots which feed on living or dead tissue. Though rare, it's a serious parasitic infection that demands immediate medical attention. How does it happen? Flies are attracted to open wounds, infections, or poor oral hygiene. They lay eggs in the mouth, which hatch into larvae within hours or days. The maggots burrow into soft tissues, causing pain, swelling, and severe damage if untreated. While most common in tropical regions with poor sanitation, oral myiasis can occur anywhere flies and vulnerable hosts meet. The key risk factors: poor hygiene, open wounds, and environments with high fly populations. This condition is a stark reminder of the importance of basic hygiene and environmental health. Understanding oral myiasis is the first step to preventing it. Let's look at how to recognize the symptoms and protect yourself. Early signs of oral myiasis are easy to miss: persistent itching or crawling sensation inside the mouth, foul taste and bad breath that won't go away. As the infestation grows, symptoms escalate: visible maggots and ulcers or gum crevices, swelling and severe pain that makes eating or speaking difficult. In vulnerable individuals like the elderly or bedridden, these signs can be overlooked until the infestation is advanced. If untreated, maggots destroy oral tissue, leading to necrosis, permanent disfigurement, and dangerous infections that can spread to the bloodstream. Recognizing the warning signs, itching, foul odor, swelling, or visible larvae, can mean the difference between a treatable problem and a life-threatening emergency. If you notice these symptoms, seek medical help immediately. Early intervention is critical. Don't ignore unusual sensations or persistent mouth problems. Next, let's see who is most at risk and why. Oral myiasis targets those with poor oral hygiene, open wounds, or compromised health. People most at risk include the elderly, bedridden, or those unable to care for their mouths, especially in areas with high fly populations. Flies are drawn to decaying tissue, infections, and unclean mouths, where they lay eggs that hatch into tissue-destroying maggots. Common culprits: houseflies, blowflies, and screwworm flies. Environmental factors matter. Rural areas, poor sanitation, and lack of access to dental care all increase risk. Poverty and limited health education also play a role. Preventing oral myiasis isn't just about brushing your teeth, it's about improving sanitation, healthcare access, and awareness. Understanding these causes helps us protect the most vulnerable. Next, let's talk about how oral myiasis is treated. Quick action can save tissue and lives. Treating oral myiasis starts with removing every maggot, usually by a doctor using forceps or tweezers. Sometimes substances like saline or mineral oil are applied to coax larvae to the surface. The area is then cleaned and disinfected to remove eggs and prevent infection. Dead tissue is removed to help healing. Antibiotics are prescribed to prevent or treat secondary infections, and pain relief is given as needed. Tetanus shots may be recommended. Addressing the root cause, like dental decay or open wounds, is essential to prevent recurrence. For those unable to care for themselves, caregivers must maintain strict oral hygiene. Treatment is about more than removing maggots. It's about restoring health and preventing future infestations. Prevention is the best defense against oral myiasis. Brush and floss daily, use mouthwash, and see your dentist regularly. Keep wounds near the mouth clean and covered. In fly-prone areas, use window screens, mosquito nets, and keep living spaces clean. Caregivers must be vigilant with oral care for the elderly or disabled, checking for sores or signs of infection. Awareness is key. Know the symptoms and act fast if you notice anything unusual. Don't ignore persistent mouth discomfort or visible sores. Seek medical help immediately if you suspect oral myiasis. Protecting yourself and others starts with simple habits and quick action. Knowledge and vigilance can prevent this frightening condition.